On Tuesday, the president had a big pep rally at the White House to boast about reaching the Obamacare goal.
Last night, the first open enrollment period under this law came to an end. And despite several lost weeks out of the gate because of problems with the website, 7.1 million Americans have now signed up for private insurance plans through these marketplaces. 7.1.
But how many of those 7.1 million people were uninsured before Obamacare took effect? Forbes opinion editor and senior fellow at the Manhattan Institute for Policy Research, Avik Roy, joined me earlier to talk about it. Avik, the president was pretty proud of the 7.1 million that he touted as proof positive that Obamacare is successful and popular. What's wrong with those numbers?
Well, he's right to say that the 7.1 million means a law isn't going to collapse under its own weight, which has been something that I know a lot of people have been talking about. The law isn't going to collapse under its own weight. But is it successful? That's a different question. And what we know already from a lot of different data points is that the vast majority of people who are signing up on the exchanges are people who were previously insured. Now, the whole point of the law was to make coverage available for people who were previously uninsured, and it's not really doing that so well.
You know, about a month ago, it was reported that only about 27% of the people who had signed up at that point had been previously uninsured. The rest were reinsurers, people who had lost their coverage and had to go onto an Obamacare exchange to get recovered. Are those numbers going to still hold up? Are we looking at 1 in 4? Is it a little better than that? Where are we on the real people who are for the first time getting insured?
It could be actually worse than that, because it's 27% or so, or maybe it's a third, who are previously uninsured, who are selecting a marketplace plan, quote unquote. But generally speaking, what the data we've seen is that the vast majority of people who were previously insured have paid their first month's premium. The people who were previously uninsured haven't. And if you don't pay that first month's premium, you don't actually get coverage. If you get sick, you have a medical bill, and you haven't paid that first month's premium, the insurer won't be there to pay it for you. So it remains to be seen whether or not a lot of those people who were previously uninsured will pay that premium and thereby get coverage. So it could be less than a quarter of people. It could be an eighth that are actually covered who were previously uninsured.
The president from the very beginning talked about, and those numbers fluctuated, 30 million uninsured, 40 million uninsured. That's what we're going to do. It's going to be universal coverage. I'm just asking myself, if the goal was to get 40 million people insured and we're at 7 million, help me understand where the joy is in all of this, and spiking the ball and acting as if we've accomplished something significant, especially when so many of them had insurance before this started anyway.
Yeah, so I mean, it's not so crazy to have 7 million signups in the first year, because you usually see with these programs, we saw it with Medicare Part D, for example, the drug benefit from 2003, it does take a couple of years for there to be full uptake of the program. But what's really dangerous here is that so few of the uninsured are signing up, and secondly, that because so many older and sicker people are signing up, that the plans next year are going to be even more expensive than they are this year. So a Manhattan Institute study that we did suggested that the average state is seeing a 41% increase in the cost of their individually purchased premiums in 2014. And if you talk to the insurers, they tell you that it's going to be another 20 to 30% up next year. So the more that goes up, the more you do bear the risk of a death spiral, so-called, where the uninsured who don't qualify for subsidies don't sign up.
Well, Avik, you've done some great research and work on this. We really appreciate your being here to bring a little clarity to it. Thanks for joining us today.
Hey, it's my pleasure. Thanks for having me.